Minister Haggie know that we are thinking about him and wishing him all the best as he recovers. Since the last update yesterday, we have 519 new confirmed cases of COVID-19 in the province. 276 of those are in Eastern Health, 64 are in Central Health, 43 are in Western Health, 125 are in Labrador-Grenfell Health, and 11 are waiting for region confirmation. There have been 134 new recoveries, leaving 2,925 active cases in the province. Our total provincial case count is 5,582. One person is hospitalized as a result of COVID-19, and just over 3,300 tests were completed since yesterday, with over 404,000 tests completed to date. Sadly, we are reporting another death today due to COVID-19 in the Central Region. And I want to extend my deepest condolences to the family and friends of both individuals that passed away from COVID-19 this week in our province. This brings the total number of deaths due to COVID-19 to 20. In just over 2 weeks, we've gone from 30 active cases to almost 3,000 active cases in our province. At this point, the sheer number of cases is overwhelming public health capacity for case investigation. This means we do not have the epidemiological data to show where the spread is or is not occurring. And for the last 2 years, our province has fought COVID in containment mode, really, and by identifying every case and contact. That is no longer possible. Our objective right now is to slow the inevitable spread. The reality of this virus is that it's so infectious, most people will acquire it, but our healthcare system cannot withstand the pressure of everyone acquiring it at the same time. We are therefore moving the entire province into alert level 4, effective midnight tonight. This will be effective for a 2-week period, and we will reassess this on January 17th. Under level 4, which is slightly modified from our previous, we need everyone to focus on keeping their number of non-essential contacts low. Your household can interact with your type 10, so up to 10 close, consistent contacts from outside your household. Informal gatherings are limited to only those in your type 10. Gatherings at funerals, burials, weddings, and religious and cultural ceremonies are limited to no more than 50 people or 25% capacity, whichever is less. Physical distancing must be maintained between household bubbles. Dancing at formal gatherings is prohibited except for ceremonial dances. Public visitations are permitted with one household bubble visiting at a time, and wakes are prohibited. Gym and fitness facilities, yoga studios, swimming pools, tennis and squash facilities, arenas, and dance studios are permitted to open with a maximum capacity of 50 people or 25% capacity per room or ice surface, whichever is less. Physical distancing between households must be maintained. Group and team sports, arts, and recreation activities are suspended. Retail stores, including those in shopping malls, can open at reduced capacity with physical distancing, and restaurants can open for in-person dining at 50% capacity as long as physical distancing can be maintained between patrons seated at adjacent tables. There is a maximum of 6 people per table, and buffets are prohibited. There are no changes for childcare services, which can operate at full capacity, and personal service establishments, including spas, aesthetic services, hair salons, body piercing, tattooing, and tanning salons, can remain open in accordance with guidelines. The high volume of cases translates into even a higher demand for PCR tests. To get ahead of testing delays, the regional health authorities have added more resources for testing, and we have removed the requirement for close contacts to have a third test between days 11 and 13. The current wait time from completing the test referral form to swab collection is now down to 48 hours. However, the time for the test to be processed at the public health laboratory is at 72 hours. The lab is running at full capacity. This means the demand for testing is exceeding the processing capacity, and the data we need to assess the outbreak is not as timely as we would like. We are therefore revising our priority groups for PCR testing, and effective immediately, anyone that is a high-risk, close contact of a case and has symptoms of COVID-19 should consider themselves a positive case and follow public health direction. They do not need a PCR test to confirm. If you are an employer, we ask that you do not require a negative PCR test for employees in this category. PCR tests are still required for anyone that is a close contact and does not have symptoms, and for those who work or live in high-risk settings such as healthcare or congregate living facilities. As a reminder, anyone that requires a PCR test to travel outside of the province is not permitted to avail of a PCR test through our public health system. You must book a test through a private laboratory. Travelers entering the province that are required to do a PCR test, such as essential workers, can still avail of a test through the public system. We are still trying to understand what impact this outbreak will have on hospitalizations. Early evidence is beginning to emerge from other countries and provinces, but it is difficult to predict how Omicron will play out when you factor in jurisdictional differences, such as the age of our population and vaccination rates. We are trying our best to follow a map for a road that is still under construction. What we are consistently seeing is that 2 doses of vaccine provides protection from severe illness, and 3 doses provide even better protection. 85,000 people aged 18 and older have received their booster dose to date, and regional health authorities continue to add more walk-in and appointment-based clinics regularly in an effort to get as many boosters administered as quickly as possible. Please be patient and continue checking for availability in your region. If we fail to act now, the repercussions in the weeks ahead could leave us with regret. We have to be decisive and proactive in protecting our healthcare resources, and we are asking again for your cooperation and patience as we battle yet another wave of COVID-19, and the biggest wave yet. I know that we all feel that we are done with COVID, but COVID is not quite done with us. Living with COVID means celebrating the good days and summoning all our grit and strength to persevere through the bad days. We are all in the same storm, but we are certainly not all in the same boat, and we all have different thresholds for stress, and not everyone has a solid support system in their lives. So regardless of your circumstances, feeling anxious or lonely is not a sign of weakness, but a sign of being human, as we all are, myself included. If you are feeling alone or disconnected, please reach out to a family member or friend. You can also call the Provincial Warm Line at 1-855-753-2560, 7 days a week from 9 a.m. to midnight, to speak with a trained peer support worker who is there and ready to listen. If you are experiencing a mental health crisis, please call the Provincial Mental Health Crisis Line 24/7 at 1-888-737-4668 to speak with a mental health clinician. This service is available to anyone who needs it. Please continue to support each other, stay connected with your family and friends, and hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. Normally we would have remarks from Dr. Haggie, but we're all sending him our best, of course. We do have Mr. Dave Diamond, CEO of Eastern Health, available for questions as well, and I'll now invite questions from the media.
Thank you, Premier. Today we have 7 reporters joining the briefing. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan of the CBC. Please go ahead, Peter.
Dr. Fitzgerald, I want to ask you about a comment you made in your introduction, that you think it sounds like it's inevitable that we're all going to get this at some point. That's a scary comment, I think, for a lot of people who spent 2 years trying very hard to not get this. Why do you think we are seeing that shift? And how do you respond to people who feel kind of deflated after all the sacrifice they've made to try and not get here?
Yeah, I know. It's not an easy question to answer either, Peter. I think, this Omicron is so much more infectious than what we've seen before. I think, it's going to be hard, and seeing the spread that we're seeing through the province right now, it is going to be hard to avoid. But we do have the tools in our toolbox to protect ourselves as much as possible. Making sure we're keeping our contacts as low as we can, wearing our masks, only going out when you really need to, trying to avoid crowds and those types of situations, gatherings, and also to get out and get your booster shot, because getting the disease is one thing, but getting severe disease is another thing entirely. And certainly we have seen that the protection that's offered by at least 2 doses, but certainly 3 doses is better of the vaccine is it's real, and I think we can all try to do our best to reduce the risk of severe disease. So getting the disease is one thing, but getting severe disease is quite another. And so we do have those tools to be able to prevent that severe disease. And as I've said before, what we have done up to now has not been for nothing. We have been able to be in a very good place with this, and all these outbreaks that we've had have helped us to know what we have to do when faced with something like this. So, but this is COVID, and it changes, and unfortunately we have to change with it.
If it is inevitable that most people are going to sort of eventually get this, then why bring in more lockdown measures? Why not just allow the virus to sort of continue to spread, especially with those low hospitalization numbers that we're seeing right now?
Yeah, so, the thing with this is that it's spreading so quickly, is that what might be happening today may not be happening, a week from now. And so hospitalizations may be very different a week from now. We don't know that yet. We're still learning about, what's going to happen. We've got to look at, we have a different vaccination rate. We have a different age composition for our population. So no jurisdiction is quite identical to the other in exactly what's going to happen. So we're still trying to learn exactly what's going to happen with regard to hospitalizations. And the problem is that if everybody was to get COVID right now, or get Omicron, the sheer numbers of people, even if it's a very, very mild disease with only a very small number of people percentage-wise ending up in hospital, that number could still be enough to overwhelm our healthcare system. So we have to be methodical, and we have to be patient. And, we want to try to stretch this out, much as we did in the beginning when we talked about flattening the curve. We want to be able to stretch out those hospitalizations over a period of time. So we want the rate of case rise to be as slow and gradual as possible.
Peter, I think everybody has to remember something that Dr. Fitzgerald said at the beginning. If everybody does get it, they can't all get it at once. And it's not just because of the beds in the hospital. It's about the human resource capacity to deal with people in the hospital, especially around nurses, physicians, allied health professionals who are isolating as well. So these are proactive measures to protect the bed capacity, not just for COVID, but for other disease entities that we know, of course, are ongoing day-to-day medical illnesses, trauma, et cetera, that continue to occur despite COVID-19. And people really need to not lose faith in the vaccines. They do work, as Dr. Fitzgerald says, it's the best defense that we have. So please continue to push the vaccines, and that will prevent the severe disease and the burden on the healthcare system.
Our next questions are from Renelle Legros with All Newfoundland Labrador. Renelle, please go ahead.
I know you're still trying to understand how this virus behaves, but based on what you're seeing in other jurisdictions, are we anticipating more hospitalizations as a result of Omicron here in the province?
Yeah. So at the moment, yeah, we would expect more. The more cases we have, obviously, there's a certain percentage of people who will end up getting sicker with this. So we would expect that hospitalizations would rise as cases rise at this point in time. As I said, we're still learning about the modeling and looking at other jurisdictions across the country and around the world. But at this point, that would be the expectation.
Again, not just about the people in the hospital, though, but it's about the people caring for the people in the hospital and making sure that we have not just a bed, but we have the human resources available to look after them should they require it.
And this question's perhaps for you, Premier. Do you think we should have gone to an alert level 4 before Christmas? Is there a reason why we stuck it out through alert level 3 throughout the holidays?
No, this is a balance that every jurisdiction across the country is currently trying to figure out, and we've always followed Dr. Fitzgerald and her public health team's advice. At that point, we didn't think it was justified. Certainly, Dr. Fitzgerald and her team didn't, and currently we're adjusting as we go. As you've seen today in Ontario, seen in Quebec on New Year's Eve. These are, we're trying to get the right balance of the economy, keeping people's personal freedoms intact, while balancing against the protection of the healthcare system. So I think, the rearview mirror is always, easier to pontificate on, but I think the right decision was made with the evidence available at the time.
Our next questions are from Jody Cook with NTV. Jody, please go ahead.
Good afternoon and Happy New Year. Just wondering if it might be easier for you to indicate for us what the actual modified part of alert level 4 is. So I've got the list in front of me. Everything seems relatively the same. Is there anything that stands out that hasn't been changed or modified for alert level 4?
So I think the biggest thing was the personal gatherings, and then the number of people allowed at a gathering, at formal gatherings. That was different in the original alert level 4 as we were moving out of alert 4, or moving out of the original lockdown, I guess. And so we have modified that now, just based on our vaccination rates and taking all of that into consideration. So we did make some changes there, mainly with gatherings.
Mr. Diamond, there are a lot of people who are frustrated that they are once again seeing elective surgeries rescheduled, some for the second time because the first time was due to the cyber attack, and now this. We've had it explained to us that this is likely due to a human resource issue and trying to protect healthcare workers from being put in isolation. Can you tell us how many now are in isolation, whereas last week we were looking around the 500 number?
Yes, I can. I think across the province, we have about 625 staff members who are isolating for a variety of reasons. Some of it is exposure that they've had in the community, or folks who have traveled, and some who have tested themselves positive. So there's a variety of reasons, but across the province, there's 625, 333 of those, as of the latest numbers I have this morning, is changing on an hourly basis. The latest numbers I have within Eastern Health itself is about 333 folks who are isolating.
All right, you've been listening to the update from Newfoundland. Dr. Janice Fitzgerald there.